Take a deep breath. Sounds easy, right? But for many, breathing can be a bit of a bother. Dr. David Rosenberg has joined us in the UH Broadcast Center to offer advice on alleviating respiratory issues. Dr. Rosenberg is a pulmonologist at University Hospitals. Welcome to our show, Doctor.
Well, thank you very much.
So as we age, are we all at risk of increasing respiratory problems?
Without question. I mean, there are two basic components of lung function. One is ventilation, and the second is oxygenation. Ventilation is simply the movement of air in and out of the lungs. Oxygenation is where that air that's breathed in, the oxygen is absorbed in the bloodstream. As we get older, there's a natural decrease in these lung functions. When you combine this natural decrease in lung function with patients who have chronic respiratory problems and by nature decreased lung function, these patients are particularly at risk for problems as they get older.
Okay, so how do you help them?
Well, there's a lot of ways, but one is pulmonary rehabilitation. This is a comprehensive program where different kinds of components are added to this patient's therapies to help their pulmonary reserve, to increase it. The different components are, first, exercise training, not just to improve their strength, but their cardiovascular fitness. The second is healthy living, better nutrition, stopping smoking if they are, hopefully they're not, and just the importance of exercising regularly. Then we teach them about their medications, the importance of the medications and how to use them. We teach them knowledge about their disease so they can ask their doctors better questions. And then unfortunately, a lot of these patients with chronic problems have a lot of stress related to their chronic disease.
Yeah, I would imagine that.
Absolutely, we want to help them with that.
Okay, and so what kind of results have you seen from this approach?
Without question, major positive things. A decrease in symptoms, less shortness of breath. They don't use their physician services as much, and they aren't admitted to the hospital as much.
Okay, sounds like it's a success, but you've also expanded this treatment option, so tell us about that. Right.
I mean, traditionally, pulmonary rehabilitation has been geared to outpatient care, but there's a whole segment of population of patients with chronic respiratory problems. They're admitted to the hospital, get better, it's time for discharge, but they're not capable of living by themselves because of their decreased reserve. We're earmarking this segment of the population. UH and Hoosier Medical Center has partnered with Menora Park Center for Senior Living in Beechwood to create a subacute cardiopulmonary rehab center. And in fact, I should mention that the rehab specialists at Menora Park and the nurses are terrific. And there are only a handful of these programs in the country. This is the first one in Ohio.
Wow. Okay, so what's the goal?
The goal is to make patients feel better, improve their respiratory reserve, improve their oxygenation and their ventilation, and to make them independent at home so they can live at home.
Okay, so it's sort of a bridge program between hospital and at home.
Absolutely.
So what happens when they do return home?
Well, we want to build upon the gains they've achieved from the program. And this can be achieved by connections with home care services, physicians who are understandable of their disease state and the importance of pulmonary rehabilitation, and obviously connections to allow them to exercise and continue training as an outpatient.
Okay, and keep that good work going.
Unbelievable.
Keep them out of the hospital.
Unbelievable.
Huh?
We think that this segment of the population will be majorly benefited by this program.
Great information. If you have pulmonary issues, University Hospitals has a pulmonary program in place to help. My thanks to Dr. Rosenberg for sharing this information, which will allow many patients to breathe easier.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth.